Hi there, thanks for joining us again. As usual, I will give a run through of today's statistics, beginning with the total number of positive cases reported yesterday. That was 685, which is 3.8% of the total number of tests and means that the overall number of confirmed cases is now 194,954. As you've heard me do many times before, I will caution against reading too much into a single day's figure, but obviously that's a lower test positivity than we've had for some time and gives us further reason to be hopeful that that is going very firmly in the right direction. Of the new cases today, 158 were in Greater Glasgow and Clyde, 120 in Lothian and 100 in Lanarkshire, and the rest of the cases are across 9 other health board areas. 1,261 people are currently in hospital, which is 56 fewer than yesterday, and we now see the number in hospital quite a bit below the peak of last spring, although our hospitals continue to be under very severe pressure. 95 people are in intensive care, that's 4 fewer than yesterday, and I'm sorry to say that 57 additional deaths were registered in the past 24 hours of patients who first tested positive over the previous 28 days, and that means the total number of deaths under the daily measurement we use is now 6,885. Every single one of these deaths is a tragedy, and that has always been the case, but as the rest of us start to gain heart from the more encouraging data, we should never forget that as we come out of this pandemic, hopefully in the not too distant future, there will be families who will never be the same again because of having lost a loved one to it. So yet again, my thoughts and condolences are with everybody in that position. Now, there are 3 things that I want to quickly update on today. The first is to flag up, as I usually do on a Thursday, the publication later on of the latest estimate of the R number. We expect it to show again that the R number remains below 1, which is positive, and indeed that's consistent with the other figures we're reporting now, which suggest that cases are continuing to decline. Secondly, let me give an update on the vaccination programme. As of 8:30 this morning, I can report that 1,354,966 people in Scotland have now received the first dose of the vaccine. That is an increase of 34,892 since yesterday. And in addition to that, I will also report today that 3,760 people yesterday got second doses of the vaccine. So we have now offered first doses to everybody over 70, all care home residents, all frontline health and care workers, and all people with a serious clinical vulnerability. Take-up rates in all of these categories have been extraordinarily high, but if you haven't been vaccinated yet and you're in one of these categories, it is not too late. You can still come forward. And as I've said before, if you haven't had any contact, perhaps your letter's gone astray or there's some other administrative problem, please make sure you are getting in touch in the first instance with your GP. I can also say today that 69% of 65 to 69-year-olds have received the first dose, and that means we are firmly on course to have offered a first dose to everyone in that age group by early March. Once again, let me thank everyone involved in delivering the programme and everyone who has so far received their first dose, and indeed those who are now starting to receive their second doses. There are a couple of other points about the vaccination programme that I just want to take a moment to highlight. The first is that we have been having, over the last couple of weeks, discussions with the UK government and the other devolved governments and with the vaccine suppliers about how we can publish more detailed information about the vaccine supplies that we have. As a result, the Scottish Government is publishing information today about the supplies we have received so far, and from next week onwards, we'll publish this data initially on a weekly basis, and it will be published every Tuesday. Comparable data about their supplies might also be published by other UK governments, but that, of course, is a decision for them. There's one point I think it's important just to highlight for anyone, and I'm sure there will be many, who pay very close attention to those weekly vaccine supply updates. The supply data that we will publish every Tuesday will relate to the stocks we have received by the previous Sunday evening. So we'll report on Tuesday for the Sunday just past. However, the daily data on vaccinations that we publish next Tuesday will cover all vaccinations up until 8:30 on the Tuesday morning. So it won't be possible to work out the vaccine doses that have been administered, that have gone into people's arms, as an exact proportion of the vaccine doses that have been supplied, because there's always going to be that one-day difference in the data. Notwithstanding that, though, we hope that regular publication of this data will be helpful to the media and to the public, because it will give a fuller picture of the supplies that we are receiving each week, and will then allow for a better understanding and indeed closer scrutiny of the progress of the vaccination programme. Now, the second issue relating to vaccination that I want to touch on is just to highlight again some of the evidence we now have, and it's very strong and compelling evidence now that vaccination is starting to work to reduce the number of people dying. I touched on this yesterday when I updated Parliament, but let me just cover it in a little bit more detail. Yesterday's National Records of Scotland figures show a 62% reduction in the number of COVID deaths which have taken place in care homes over the past 3 weeks. And that is a larger decline than we have seen for deaths happening in hospitals or in people's own homes. And as a result of that, the proportion of COVID deaths, the proportion of the overall number of people dying taking place in care homes, has fallen from 34% around the start of this year to 13% last week. And with the exception of 1 week at the end of August, when there were only 2 COVID deaths registered overall, care homes accounted for a smaller proportion of COVID deaths last week than at any time since March of last year. In other words, at any time since virtually the beginning of the pandemic. So that does give us quite strong confidence now that the early vaccination of care home residents and the focus on trying to maximise uptake within older people's care homes is now having the impact that we desperately hoped to see it have. Now, I know, and I'm always very aware of this, that it sounds jarring to talk about positive news in the context of daily and weekly death tallies, which remain heartbreakingly high. But this initial indication that vaccination is starting to protect people is undoubtedly really positive news. And we hope that the signs of that protective effect will strengthen in the weeks ahead. We're already seeing some early similar signs in the older age group living in the community. The over 85 age group saw the biggest reduction in deaths in the figures that were published yesterday. But we hope to see that strengthen in the weeks ahead, and we obviously very much hope to see that deaths will start to fall significantly amongst the other groups that are being vaccinated as well. Now, the final point I want to touch on relates to a further expansion of our testing programme. I've mentioned before that we're expanding testing, particularly now that we have access to what are called lateral flow testing devices. So we're expanding to people working in key public services and in critical infrastructure. Since December, many health workers who deal directly with patients, even if they weren't previously classed as frontline staff, have been offered twice weekly self-testing. And from this week, that's being expanded to include NHS 24 and Scottish Ambulance Service call handlers. And testing is also being offered to all people who work in hospices. Over the coming weeks, we'll further expand testing to people in the primary care sector and independent contractors who come into contact with patients. In many cases, they're not directly employed by health boards, but they obviously perform an immensely valuable role. So what that means, for example, is that regular testing will be available to staff in pharmacy, dentistry, optometry and general practice, including support staff such as receptionists and cleaners. And the aim is that by the end of March, all healthcare workers who come into contact with patients, whether that's in hospitals or in primary care settings or the wider community, will be able to self-test twice a week. These tests will use lateral flow devices, which most of you will know by now give very rapid results. That's why they are useful, but they are less sensitive than PCR tests. So for that reason, anyone who tests positive through a lateral flow device is always advised to book a PCR test so that the result can be confirmed. And tests generally, and it's important to make this point, are not a magic solution. They're really important and are a key part of our fight against this virus. but they are most effective when they work alongside other protective measures. But they do undoubtedly provide an additional layer of protection and increase our ability to identify people who have COVID but who might not have symptoms, so that we're breaking more chains of transmission. Those are the points I wanted to cover today. I'll end as usual by asking everyone for now to stay at home except for essential purposes. Please do not meet with people from other households indoors. And when you're outdoors, please meet with no more than one other person from one other household. Please continue to work from home if possible. And employers, remember you have a legal duty to support people to work from home. And when you are out for essential purposes, please remember facts, face coverings, avoid crowded places, clean your hands and surfaces, use 2 metre distancing and self-isolate and get tested if you have any of the COVID symptoms. Above all else, though, please for now stay at home as much as possible. I know how difficult that is. We're all finding that increasingly difficult, but it is working. Case numbers are coming down. The numbers of people in hospital and needing intensive care are coming down, and we are now seeing fewer vulnerable people dying from this horrible illness. And it's because of that progress that in just a few days' time, we'll start to see preschool children and pupils in primaries 1 to 3 return to school. And if we all continue to stick with it for a bit longer, while we vaccinate more and more people, we will enable more children to get back to school, and then we'll make it safer to start to ease other restrictions as well, albeit that we need to do that carefully and gradually. So please, for now, stay at home to protect the NHS and save lives. And thank you to everybody who is doing that. Now, before we move on to questions today, I'm going to hand over briefly to the Chief Nursing Officer. And before I do so, let me say today is the last time Fiona will join me here today, because this weekend she retires as Chief Nursing Officer. Actually, she was due to retire around about a year or slightly more than that ago, but agreed to stay on to help us through this crisis. And for that, I am hugely grateful to her, as well as being very grateful to her for her service as Chief Nursing Officer. But before she departs, I know Fiona very briefly just wants to say a few words of thank you from her to nurses across Scotland. So I'm going to hand over to her before she and I take questions as usual from the media. Fiona.
Minister, thank you. We stand here and there are so many people to thank, whether it's our cleaners, our admin support, our hospital engineers. But if I may be indulged today to say a huge thank you to the nurses and midwives across Scotland. You have been an amazing force to help the country through this pandemic, whether it has been walking alongside families who have been bereaved, life-saving work in intensive care, whether it's our school nurses or our health visitors supporting vulnerable young people, and of course supporting people with a learning disability, mental health problems, and our sick children's nurses. Thank you from the bottom of my heart for everything that you do for the people of Scotland. And of course, now our vaccinators will be going round our care homes, our nursing vaccination teams, to give our care home residents their second vaccination. I think there is almost nothing within this pandemic that has not had nurses and midwives throughout this providing that support to the country, and I'm incredibly grateful to you for all that you do. Thank you very much.
Thank you, Fiona, and I would echo that thanks to our nurses, but also I'm sure I speak on behalf of everybody across the country when I say again thank you to Fiona for her service as Chief Nursing Officer. We'll move on now to questions, and she's got to get through a question and answer session with me first before she gets away from this. So first of all, Matty Sutton from ITV Border.
Thank you, First Minister. We've been talking to women in the borders who are running new businesses, and they've told us the challenges that they're up against because of the pandemic and juggling unpaid work with running their businesses now mostly online. One woman told us that she thought there'd been a complete regression when it comes to women and working. Can I ask, do you agree with that? Are we in danger of reversing the gains that women have made? And what action is being taken by the government to make sure there isn't a long-lasting impact on gender equality?
So I think that's a really important question, and I don't think we should be complacent about it. And our task, starting with the government, is to do everything we can to make sure that that regression that people may be worried about doesn't become a reality. I don't think there is a single person in the country who hasn't really struggled over the past year. People will be struggling to different extents and in different ways, and while we're all in this crisis together, we are not all experiencing it in the same way. But I don't think there will be anybody who hasn't found it difficult emotionally, in a mental health sense, financially, and in terms of juggling work and caring responsibilities. So there'll be many men in that position. So please, when I go on to say what I'm about to say, if you're watching and you're a man in that position, I'm not trying to diminish the difficulties you will be facing. But given what we know about the greater proportion of women who do have the primary responsibility for caring for children and caring for older relatives, given that we know that women are disproportionately present in some of the workforces that have been most affected by this pandemic, health and social care being two of the top examples of that. And given that women will also be disproportionately affected through working in areas like hospitality, for example, I think it is a reasonable conclusion to draw that women will have been, or many women will have been in some way or other disproportionately affected by this. And you raised the question in the context of a woman running a business from home, online, while homeschooling children and caring for children. So that undoubtedly has been particularly difficult. We need to make sure, though, that that is a temporary effect, and that as we come out of the pandemic, we don't see that longer term regression that I know many people will be worried about. There are many ways in which the government and others will have to act to try to ensure that's not the case, and I won't have time to go into all of them today. But firstly, getting children back to school as quickly as possible is first and foremost about the well-being of children. But if we are successful in doing that, then that will also have a knock-on impact on women's ability to work and reduce some of that pressure. Making sure that we are targeting financial resource at families, particularly on low incomes or whose income has been affected by the pandemic. We've already taken some steps to increase the income of families in that position. We're going to do the same again in the spring. And of course, the new Scottish Child Payment is very much focused on that, making sure there's support for workers in different sectors and employers in different sectors, not just for the short term, but where necessary for the longer term as we go into recovery. And then, of course, making sure that we're bringing all of this focus that we brought to tackling the pandemic when we're able to recovering the economy. Not in the kind of way where it just goes back to how it was before, but in a way, hopefully, that deals with some of the pre-existing inequalities and actually builds something better than what we had before the pandemic. Now, that's all, makes it sound easy for me to say it in that very brief few minutes, but that's a massive, massive body of work that we've got to do. But there is no doubt the inequalities that existed in our society before this pandemic have been certainly highlighted in a way that they hadn't been before, but many of them have been exacerbated and new inequalities have been created, and we've got to have a real focus on that as we move forward. Ewan Petrie from STV.
Thank you very much, First Minister. I was just looking to get your reaction to the Education Policy Institute report on support for catch-up in schools. It does recognise spending per pupil here is the highest of the 4 nations, but it also says current plans are insufficient, they're not targeted towards poorer pupils, and they don't provide guidance on supporting children with additional support needs. We spoke to one parent who said ASN kids are a forgotten group and they've had to fight to get their child any time in school because the guidelines on vulnerability are not clear enough. What would you say to them?
The report is one that we want, and I want us to look at very carefully. I've asked my officials to try to do a proper analysis of it to see whether there are any lessons we need to learn from it. So what I'm about to say to you today by necessity is an interim response to this. On the upside, which you've alluded to already, the report finds that so far Scotland has committed the most money per pupil to school catch-up plans, and they estimate that that is around £200 per pupil in Scotland compared to £174 in England, £88 in Wales and £82 in Northern Ireland. The point the report makes, which is the one I want us to look at very carefully, is that we are not targeting that perhaps as much as others at disadvantaged pupils. Now, what I can say at the moment is that the report itself acknowledges that it's not taking account of all of the government's investment in education recovery. So there are, and we would estimate that when you take into account all of it, it would actually equate to about £425 per pupil. So there are elements of our spend on education recovery that we don't think the report has properly taken account of, and the report acknowledges that, and I think that would change that assessment on targeting to disadvantaged pupils. We're also not entirely sure, and this can be part of the further work we do, exactly how the authors of the report have determined some of these conclusions. We have already invested money, for example, in recruiting more teachers, which almost by definition will help young people in disadvantaged areas. But I don't want to stand here and giving that initial response sort of close my mind to the fact that there's not maybe something that we can learn from the analysis that's been done. It's really important that we invest properly in this, and the report would suggest that, relatively speaking, they think Scotland is doing that, but that we make sure additional investment is targeted. We have the pre-existing Pupil Attainment Fund, which was established to close the attainment gap and therefore target money at areas of disadvantage. So that's already mainstreamed into how we invest in education. So once we've had the chance to look at the report in more detail, there may be more that we want to say about this, but the determination we have to make sure that we are getting proper investment to do this job, but targeting that investment properly is absolute. And therefore, I think any piece of work that tries to contribute to that, even if we ultimately don't agree with all of its conclusions, is certainly going to be helpful in making sure that we are properly challenging ourselves to do everything that we can. Katrina Renton from BBC.
Good afternoon, First Minister. Just going back to the number of cases that you were talking about, yesterday the numbers were still quite high at 1,100, but obviously today it's much more encouraging. And from what you've been saying, I know you're saying don't look at one day in isolation, but do you think this is now the beginning of a trend towards us getting back to some kind of normality?
On the case numbers, just in case you think she's getting away scot-free today, I'll maybe ask the Chief Nursing Officer to give her final reflections of where we think we are in the pandemic. On case numbers, as people, regular viewers of this briefing will know by now, I usually say don't focus too much on a single day, but also I'm not saying don't focus on the overall number of cases, but remember to put the overall number of cases in context next to the percentage of tests that are coming back positive. So yesterday we had over 1,000 cases, which was a high number of cases. The sequence of this information coming to me every morning as I get the total number of cases first, and then it's a couple of hours before I get the test positivity. So there's always a bit of an anxious couple of hours for me. Yesterday I'm looking at that really high relative to the last couple of weeks' number of cases, thinking, is this genuinely a bit of an upsurge? But the test positivity yesterday, if memory is serving me correctly, was just around 6%, which is above that 5%, but still indicative of that downward trend. Earlier on in the year, test positivity on a 7-day rolling average was above 10%, so that would suggest it's coming down. Today, we've both got a smaller number of cases and an even lower test positivity of 3.8%. The other thing I would say, just contextually, is that there is and again, those who look at these figures carefully might see this. We tend to have, because in the overall testing figure, we have some groups that are done routinely every week through PCR testing, like care home workers, and there will be a particular part of the week where most of them are being tested. So that will inflate the overall number of tests that are being done, the overall number of cases coming back positive, but shouldn't inflate the test positivity. So there are some features that we just have to be conscious of. Before I hand over to Fiona, and just to bring all that together, cases are declining in Scotland, test positivity is declining, and actually what gives us the greatest confidence in that is that we also now see hospital admissions declining as well. So there are fewer people becoming ill, which is, reflective of the fact that there are fewer people with the virus. Now, as vaccination kicks in, that may not be as simple an equation to draw, but that is certainly the case just now. What we think, though, and I said this, I think, in Parliament yesterday, is that we may be seeing a bit of a slowing down of the rate of decline. And that is one of the reasons that makes us, albeit really positive about the progress we're making, still mindful that we need to be cautious. Scotland's, and again, if you go on to any of the sort of data sites and look at the relative positions of Scotland, Wales, Northern Ireland and England, what you find is Scotland, for most of this pandemic, there's been periods where it's not been true, has had a lower overall number of cases. And when we've been seeing really deteriorating positions, our cases have gone up, but often not quite as sharply as in England, for example. But when they've started to come down, they've come down more gradually as well. And that may just be a feature of a slightly lower level of overall cases. So that's a long-winded way of saying everything right now is really positive, genuinely really positive. But we can't afford to take our foot off the brake too quickly, because we know from experience that when prevalence and incidence is still quite high, it can quickly go in the wrong direction again. And we've also, of course, got this new, more infectious variant that just makes that even more necessary to be cautious. And so as we start to plot our route out of lockdown, which we'll start to do next week, you will see, hopefully you'll see, the ability, you'll be able to see that route out. But it will be deliberately quite cautious, because none of us want to set this progress back. I want, if at all possible, this lockdown to be the last one we need. And that means that we need to make our recovery out of lockdown not just as quick as possible, but perhaps more importantly, as sustainable as possible, so that we keep going in the right direction. Fiona.
And absolutely, I think we should be hopeful. We should be positive about how we're going forwards, but we're in the position we're in today because of the restrictions that have been put in place, and we have to remember that. And we also have the vaccination programme, and again, the green shoots of that are showing positivity, which should give us hope and plan to move forwards. But like everything in this pandemic, there are always new layers and new information about the virus that we learn as we go along, such as the new variant is highly transmissible. We still have broad levels of community transmission. So we're not talking about the 600 and odd cases being in pockets of easily tracked outbreaks, that there's still broad community transmission, and that prevalence in the community will make us cautious. I think the other aspect is when we unpick the layers of the numbers, we are seeing more younger people, so people from 20 to 45 say having positivity, and also our clinicians within our hospitals are saying they're seeing more younger people within intensive care and within our hospital wards being very unwell. And that is different to where we were at the early stages of the pandemic. I think what the numbers should do is give us hope, give us confidence that what we are doing is the right thing, but also that if we keep doing them, then we will get out. Because if we were to lift restrictions, then there's absolutely no doubt the transmission would increase, and we would then have lost the gains that we've made. But by having a confidence about doing what we're doing means that we will be able to step forwards confidently, knowing that we will continue to see reduced transmission, continue to keep people safe within our communities, and be able to get back to whatever the new way of working will be after the pandemic.
Thank you. Peter Smith from ITN.
Thank you very much, First Minister. And just firstly, I wanted to express my thanks to the Chief Nursing Officer for staying on in the pandemic. Wish you all the best in your retirement. Maybe not a retirement cruise yet, but hopefully soon. I have two questions. The first one on the vaccine rollout just now, and specifically on people with learning disabilities. At the moment in Scotland, they're not on the priority list. We know that people with learning disabilities are several times more likely to die through coronavirus. Even in the 18 to 34 age group, the younger people are still far more likely to die than other parts of society. They're disproportionately affected by going into hospital, and also more disproportionately affected through lockdown. I noticed that in Oxfordshire, they've started to roll out the vaccine, prioritising now all people with learning disabilities, not if they've got other underlying health conditions, not only the severest learning disabilities. And I just wonder if you would be minded to follow that. If not, what are the arguments against giving all people with learning disabilities a vaccine?
Thank you. Firstly, I absolutely recognise the importance of this to people with learning disabilities and to their families, whose anxiety right now will be very acute. And so I absolutely understand why this is being raised and is being raised with such urgency and often with such understandable emotion. I covered some of this in Parliament yesterday, so forgive me. Many of you, including you, Peter, will have heard me say what I'm about to say, but I'll come on to the last bit of your question at the end. most people with learning disabilities, perhaps not all, I recognise that, will be included in either the JCVI Group 4, which have already all been offered vaccination, or the JCVI Group 6, which is, as of next week, about to be invited for vaccination. So most people with learning disabilities in one or other of these groups will either have been vaccinated or will very soon be vaccinated. But there is a question that has been raised with me, and therefore I have a duty to raise it with my clinical advisors. And the reason I say that is I've always been of the view, and I was of this view when I was Health Secretary, I remain of this view now, is that it is not right for somebody like me, a politician with no clinical training or expertise, to be making the decisions about who gets the vaccine and in what order. It's one of these issues where it's really important that people like me listen to clinical advice. So I will be continuing to, question and ask for that advice. And which takes me on to the last point. I am not standing here right now familiar with what you've just said about Oxfordshire, but I will go away and look at that and ask the Chief Medical Officer in particular whether there is anything they're doing there that should influence what we are doing, and if that would then accelerate anybody with a learning disability who has not already been vaccinated or will not be vaccinated over the next short period, get the vaccine. And I'll specifically do that as a result of the question that has been raised.
The second question, just First Minister, if you don't mind, it was actually about the PPE issue. Yesterday in Parliament, you'd said that Scotland never ran out of PPE during this pandemic, and we know that there wasn't necessarily the case that there wasn't any at all, but there were logistical issues. I just wonder if you could clarify what you meant when you say Scotland never ran out of it, but is there a fundamental difference in terms of lessons learned between whether it was stuck in a warehouse abroad or stuck in a warehouse or storage cupboards in Scotland? Because the most important thing was that people who were on the front line, paramedics, nurses, said they didn't have the PPE they needed to keep themselves safe doing the job.
So I'm happy to address this again. I don't think I need to clarify it because I think I did go through this quite clearly in Parliament yesterday. What I meant was, and what I mean is, and this is just a statement of fact, there was no point at which in Scotland we said we have literally run out of masks or gloves. Now, I say that because that's not unimportant, because some countries did. In fact, I think there was a period, and this would have happened in reverse, so I'm not making any political point here. We gave mutual aid to England, I think, who had run out, actually physically run out of one aspect of PPE. But what I also said in Parliament yesterday was that in the early stages of the pandemic, we did have challenges with distribution. It didn't flow as quickly or as smoothly as we wanted it to. But we acted, and this was for periods in the earlier phases, a regular topic of questioning at these briefings. We took action as we went along. We fundamentally changed the distribution methods we used. We also put whole new supply lines in place for care homes, because previously the government hadn't been involved in supplying PPE to care homes, but we put a supply route in place there. So we tried to act as we went along. We put in place an open email number for any frontline health worker who felt they weren't getting what they needed when they needed to get in touch, so that we could address these things as we went along. And I suppose the other point I would make is this, and Fiona might want to say something here. There is probably to this day, there will be differences of opinion between those who advise me and people on the front line about whether the precise specification of particular bits of kit they're using are appropriate for the circumstances they're facing. And that's something we regularly look at and review to make sure that is as it should be. The final point I would make is this one. It is right and proper for me to get questioned on, did we make mistakes, did we get things wrong? I've tried to be pretty candid. We made mistakes in the early stage of the pandemic. There are other things we got wrong that it's probably less fair to describe as mistakes, because we did what we thought was right based on what we knew. So you have things in both of those categories. And right now, asking me what I think we got right and wrong, while legitimate, is almost inviting me to mark my own homework. I've got an opinion on whether I think certain criticisms of us are fair, and there are very fair criticisms, including problems with distribution and PPE at the outset. There are some other criticisms that are made that I think are less fair, but that's my view. It doesn't mean they're not fair. The point here is, ultimately, it will be for some independent process, a public inquiry to look properly at where we got things right and where we got things wrong and where we need to learn lessons from the future. I can only ever give my opinion, but I'm obviously not the most objective person when commenting on this because I've been so immersed and at the centre of it. But we have genuinely tried to be frank about the things that didn't go as well as we wanted them to, and not to wait until a future point to learn lessons, but to learn as we go. And I think we did that with PPE. Did we always get it right? Will we ever get to a position where every single health worker thinks that they've got exactly the kind of PPE they need? Perhaps not, but we'll never stop trying to make sure that we've got that as right as possible.
And I think at all times we have followed World Health Organisation advice, our own infection prevention and control specialists within Scotland who have worked across the UK to have infection prevention and control specialist expert advice across the UK. And at all times we have taken their advice and put that in place in terms of what PPE is required for our staff. I think at first there clearly anxiety from staff about, is it good enough? Is it strong enough? And people were anxious about what the advice was, but the advice was based on evidence. As we grew to know more about the virus, then some of that advice changed about what appropriate PPE was. And we had a stockpile in this country, but what was happening was we were in a global pandemic. So sourcing material, when there is worldwide demand on it, was a challenge, and a real tribute to National Services Scotland, who managed to keep our supply chain going. And yes, at times, and I remember talking to some of the nurse directors and the nurses within hospitals, in our big hospitals, then there had to be movement of PPE around, and there is no doubt when a big supply came in, there was a sigh of relief. So I think at times it was often a worry about, would people be allowed to wear the PPE that they needed? Would we run out? And there is no doubt some of the distribution to our care homes was a real challenge. But I think we did have sufficient PPE. We followed stringently the advice that was given. And yes, at some time people will challenge, is that the right advice? But all we can do is take advice from our experts who will look at the evidence, look at the research, and as we learn more about this virus, then we may or may not change. And of course, stepping back to whatever we would call our routine PPE will also happen. And again, we'll follow the science, we'll follow the advice, and make sure that we protect our staff in the very best way possible.
Thank you. One final point on PPE, which I think is really important. At the start of this pandemic, virtually all of our PPE was imported. Over this winter, because of some of the developments over the course of the pandemic, about half of all the PPE is sourced within Scotland. So we've actually, in learning some of these lessons, we've strengthened the domestic supply chains, which should hopefully stand us in good stead for the future, and hopefully it will be a calmer and more normal future than the one we've been going through for the past year. Alan Smith from Bauer.
Thank you, First Minister. Holyrood's COVID committee this morning was hearing from members of its citizens panel who say they want the Scottish Government to be following an elimination plan. And that's led to a lot of discussion again this morning about whether elimination of this virus is feasible in Scotland. I just wanted to get your thoughts on whether you think eliminating the virus is doable within Scotland, and how you would define your current strategy.
I've always been on the part of the school of thought that says we should be seeking to eliminate, and I'll come on in a second, because I think some people, as with most terms like that, different people will mean slightly different things about that, and it may actually mean something slightly different in a country like Scotland compared to a country like New Zealand, but that doesn't stop this, that doesn't change the overall objective. So we have, since way back last spring, early summer, in Scotland, said our objective should be to eliminate, by which I mean get suppressed to as low as possible a level, and then try to keep it there. Now, is that feasible? The evidence and the work that's been done around genomic sequencing would say yes, because what it shows is that we actually achieved that in the summer in Scotland last year. Most of the strains of the virus that had been circulating in Scotland were eliminated. And then what happened is that it receded mainly from travel, some overseas travel, some from travel across the UK. And that will have happened in both directions. It's not a one-way street. So we know we can do that. And I think we're still some way off it on the data we've got just now, but I think we're on a path back to that suppression to very low levels. The challenge is, how do you keep it there? And so we didn't do that last summer because it became receded. And what we've got to do better this time, when we get it to those low levels, as low as we possibly can, is keep it there. Now, that will be a combination of things. Test and protect, which, played a big part in the extent to which we did do that for a period last year. It will be perhaps for some time yet, travel restrictions and perhaps even more importantly now with the virus mutating and new variants being identified. It may be even as we come out of lockdown that there are some restrictions we still have to live under for a longer period, face coverings, stringent hygiene, some kind of physical distancing. Now, I don't know any of this for sure right now, but keeping the virus at very low levels is always the hard bit. Now, what do we hope? That the impact of the vaccines on transmission will be a huge part of how we do this, but we don't yet know that that's how the vaccine is going to operate. We have believed, and this is now coming through in our data, that it is going to stop people becoming very ill and dying, but we don't yet know whether it will have that suppressive impact on transmission. So we're on the path to this right now. The worst thing we could do just now, and we can say this now not just from theory, but partly from our experience last year, is get all of this progress hard won on the part of all of us, and then let up too quickly so that it all runs out of control again and we're back to square one. So we're going into, I reckon, one of these, every phase of this pandemic has been difficult, but the difficulty of this next phase will be similar to late summer last year, where everybody said, oh, the virus, case numbers are going down, deaths are going down, let's open everything up really quickly. And I'll feel that pressure because I'll have, understandably, people from all sorts of walks of life putting that pressure on. And my job is to try as hard as I can to get those decisions right and strike the right balance so that we do have a move out of lockdown, but that it is sustainable and not just quick. Because if it's quick at the expense of sustainability, the danger is, as we start to look at next winter again, we'll be back in lockdown. And none of that's going to be easy to achieve. But what I know from experience, as well as the scientific advice I get, is the lower we suppress it right now, the more able we will be to achieve that sustainability. And also, last point is this. We also know that when a virus is circulating at quite high levels, that's when it is more likely to mutate and more likely to throw up new variants. And that is the risk that we face now that we weren't as cognisant of last summer. So none of this is easy. None of it is going to get easy. But we're in a much stronger position than we were a couple of months ago. We're in a stronger position than we were in some ways than we were last summer. We've got new variants now, which is on the downside. But on the upside, we've got nearly 1.5 million people vaccinated. So we've got so much reason to be optimistic right now. But we've got to stick with it so that we're coming out of this sustainably for the long term, which is what we all want. You want to add anything?
No, I think the virus depends on us to transmit it, and therefore our behaviour is going to predict what happens to the virus. And at the moment, there is too much of it around for us to start moving around safely. But that eliminating to the lowest possible level, I think, is something we could achieve and we ought to be able to achieve. We just need some patience.
Phil McDonald from Global.
Thanks, First Minister. Just on care home deaths, obviously the latest NRS figures are quite encouraging, given that they're falling significantly. But I was wondering if any modelling has been done or if any predictions have been made for when deaths in care homes will be down to zero, or if that's even going to be possible.
I haven't seen any modelling that would give us the ability, or give me the ability to stand here and try to put even an approximate date on that. But care home deaths now are falling really rapidly. and 62% reduction in the last 3 weeks. Now, as we see the virus cases fall, as we see hospitalisations fall, you would be expecting to see care home deaths falling in line with that anyway. What's significant about the latest numbers is that they are falling disproportionately in care homes. So, the overall, I think, I'm not getting this number perhaps exactly right because I don't have it in front of me, but overall deaths in the last 3 weeks have maybe fallen by around 30% or thereabouts, care homes 62%. At the start of the year, the percentage of total deaths that were in care homes was about a third. It's now down to 13%. So we're definitely seeing that rapid reduction, and I would hope over the next few weeks we will see that fall further and perhaps even faster, given the level of protection that we hope the vaccine will be delivering to those most vulnerable in our care homes. So I can't say for certain, but I know that of all the things I'm looking at just now that are giving me cause to smile occasionally, then this is probably at the top of the list. And let's watch it carefully over the next couple of weeks. Katrine Bussey from PA.
Hello, First Minister. As we start to look ahead to how we might begin to emerge from this lockdown, you've stressed always the need for caution, but one area that seems to slightly jar with this approach is the assumption that we'll be having an election campaign in April and indeed an election for the Scottish Parliament in May. So I just wanted to ask if you were satisfied that it was safe to proceed with that. And also on the issue of the election, many of the polling stations where people go to cast are schools. And I wondered if that would be the case again this time round. So how you thought parents might feel when children who have lost weeks of schooling over the course of this pandemic, if they may have to miss a day or even 2 days of school because Holyrood's passed legislation that could allow for the polling to take place over a couple of days if that was thought to be necessary to ensure that sort of social distancing could be maintained. So I just wondered how you thought parents might react to that if that was to happen.
I'll give you my views on this. I'll preface that though by saying there's something a little bit invidious about a politician who's about to face the election being the one commenting on how that election should be conducted. So in terms of where polling stations are located, what exactly the arrangements are, that's rightly and properly for local returning officers, and I think it's important that is made clear. Similarly, Parliament on a cross-party basis put in place contingency legislation at the turn of the year. There is no certainty that all aspects of that contingency legislation will be required, including having the poll over more than 1 day, for example. My view, and it's been my view all along, is that if it's at all possible, the election should go ahead because we live in a democracy, and it's right that people, perhaps even more so in a crisis, get the chance to cast their verdict on the government that is running the country and decide whether you want me continuing to steer us through coronavirus or not. I think it's important that democracy happens, but of course, nothing happens right now without careful consideration of the safety issues, and therefore, while I hope the election will go ahead, if there was any change to that, that wouldn't be just a decision for me. That would be a cross-party decision with the presiding officer of the Scottish Parliament involved in that. But assuming it does go ahead, it will. I think it's fair to say this, and I don't think I'm saying anything controversial here. It's not going to be an election as normal in the sense that we're not all going to be campaigning in the way we normally do, chapping on people's doors. Maybe in the later stages more of that will be possible, but right now that's not possible. There will be arrangements that have to be made for the safe conduct of voting and counting. The other point I would make is that there are local by-elections underway right now. So in March, there are going to be local by-elections. So people who are responsible for running elections have decided that these can go ahead safely. So these things all have to be taken account of. But where possible, I think Over the course of this pandemic, this number won't be accurate to a fine point here, but I think something like 70 countries have had elections in the course of this pandemic. So it can be done, but of course, careful consideration has to be given to how it is done safely. And as I say, that cannot be a matter for me or the government to be in sole control of. And of course, people can apply for a postal vote, and perhaps I know, certainly from my own anecdotal experience, there are many people who might not normally vote by post who are considering getting a postal vote this time because of the circumstances. Derek Healy from the Courier.
Thank you, First Minister. Just following on from Alan's question earlier, Dr. Christine Tate-Burkhardt from Edinburgh University has said an elimination strategy is possible in countries like Australia and New Zealand because international travel can be more easily controlled. But she said it would be hard to achieve a similar result here in the UK. So for clarification, can you confirm, is the Scottish Government at this stage still aiming to eliminate the virus in Scotland? Do you have any sort of timescale yet, maybe a kind of best case scenario for when you believe that might be achievable?
On the last point of the question, no. I just don't think you can do that. I could stand here and give you arbitrary dates, but they would be meaningless, and I'm not going to do that. We will drive this infection to the lowest possible levels by all of us continuing to do all of the things that we have been doing in the past wee while. And hopefully, depending on its impact on transmission, the rollout of the vaccine programme will help us with that as well. But it doesn't happen by magic. You know, we need to drive the infection levels low. I'm not sure, in terms of the first part of your question, that I've got much to add to what I said to Alan. Something being harder to do in Scotland than it is in a country like New Zealand doesn't make it impossible to do. But yes, and I've always said, people who watch this regularly will have heard me before talk about how, while I've got great admiration for how New Zealand has dealt with COVID, Scotland is not New Zealand. The integration of travel patterns across the UK, our position vis-a-vis Europe more generally, is very different to the situation geographically that New Zealand is in. So there are different challenges there. But we showed last summer we can drive it down to very low levels, which is what I mean by an elimination strategy. Get this as low as possible and then keep it there. Keeping it there brings different challenges for a country like Scotland because of the travel issues than it poses for countries like New Zealand. That's just a fact of life. But does that mean it's wrong to try to do it? No, because we know that the lower the virus is, the less chance of it mutating, the less chance of outbreaks of it quickly seeding community transmission that then has it running out of control again. And actually, the lower you have the overall level of the virus in the community, the more normality you can bring back to the economy and society, and the more sustainable you can make that. So it's in my view, the right objective, but different countries and different geographical locations with different circumstances will face a host of different challenges in trying to achieve it. But it doesn't make the goal any less valid.
I think the one other thing to add is the real importance of our test, trace and isolate teams. And that's when contact tracing will be absolutely crucial, so that every single case is tracked down both backwards and forwards. And we are already planning, so clearly we have, I think, a very, very good track and trace service within Scotland. But that is going to become even more important as part of our armoury to make sure that the virus is kept to the lowest possible level. And clearly, the whole issue about continuing to be tested if you have symptoms, but in particular isolate if you're a contact, is going to be incredibly important. But by that time, we should be going back to the time where we could probably name every single outbreak there was and know the numbers, because it should be very, very low. But our public health teams, our health protection teams and the test and trace teams will continue to have a real criticality as we move out of this.
Okay, not for the first time I am talking too much because I'm only about halfway through the questions, so I'll try to speed up a little bit. Dan Vevers from The Sun.
Thank you, First Minister. Good afternoon to you both. Will your lockdown exit plan include trigger points for when parts of the economy can reopen? And if so, could you suggest what they would be? The Scottish Chambers of Commerce was calling for this earlier in the week. They said they understand the difficulties in setting specific dates, but do you agree with them that at least knowing what would trigger certain sectors reopening could give businesses the confidence to plan to hire and to invest? Thank you.
No, I won't set it out today because I'm going to set it out to Parliament next week. And as I said in Parliament this week, it will focus on data over dates. There's no point us setting arbitrary dates that we then feel bound into if the data is not enabling that. So what it will seek to set out, it will draw heavily on advice from the World Health Organization, is what you are looking. It's never going to be an absolute science, but what you are looking to get the data to before you can start to ease things. But I'll set that out in more detail next week. Tom Martin from the Express.
Hi, thank you, First Minister. If I could just return to the vaccination programme. You referenced again in your opening remarks groups 1 to 4, everyone in groups 1 to 4 having been offered a vaccine. But as of yesterday, we know 1 in 5 in the Shielders group haven't got a jab as yet. So I just wondered what's going on in that group, because obviously in the other groups we're seeing, uptake of 90% or more, or being exceeded. Whereas, we're looking at about 80% in Shielders. So are they falling through the cracks in any way?
No, they're not falling through the cracks, but we still need to make sure we're getting to as many people as possible. I know you weren't meaning to do this, but we've got to be careful not to mix up people offered vaccine. We've talked about this a lot in the care home context with the uptake. So everybody in these groups has been offered vaccine, but the 80%, it was 80%. Yes, I'm just looking. I think it's about 83% today, but I'm struggling to just locate that exactly. But I think it's about 83% today in that group have actually taken up the offer of vaccine. Now, actually, that's relatively good in relation. I saw, I think this was up to date as of yesterday in Wales. It's about 81%. Now today they may be 83 or 84. So it's similar to the position in Wales. I don't think, although I might be wrong here, I don't think England is publishing at that level of detail yet. So it's a good uptake compared to other vaccination programmes, but it's not as high as it is in other groups yet, which is why we need to, now why that may be down to the vulnerability of people, it may be down to a whole range of factors, but the teams will continue to work to get to as many people as possible. The other caveat I would just attach around this group, and I think you've asked about this before and I've given this answer, is that there'll be duplication. So many people or some people in the clinically extremely vulnerable group will also be over 80 or over 70. So it's quite hard to really completely isolate the people who are only in the clinically extremely vulnerable group. So there's a greater degree of uncertainty around the estimates we're using for that population, but they've all been offered, apart from the usual caveat that there may be administrative things, which means some people haven't, in which case get in touch. But everybody should have been offered, and now we will continue to try to drive uptake levels as high as we can.
And contact your GP. It's not, you haven't been last week, so you'll not be offered it again and you've lost your chance. We would encourage people to take the vaccine, and contact your GP if you've not had an appointment, or if you weren't sure about it and you want to make it, and it's absolutely still there for you. And as the First Minister said, over 80% of an uptake of a vaccine, we would normally be absolutely delighted with that level. So it's good, but we know we can be even better.
Simon Johnson from The Telegraph.
Thank you, First Minister. As you said, your strategic framework next week will focus on data rather than dates for easing lockdown in Scotland. Professor Mark Woolhouse, Professor of Infectious Disease Epidemiology at the University of Edinburgh, who sits on your COVID Advisory Committee, told the Common Select Committee for Science yesterday, quote, "My conclusion from that is if you're driven by the data and not the dates right now, you should be looking at earlier unlocking." And he was referring to the excellent figures that we're seeing on the vaccines reducing both hospitalisation and death. So I'd be very grateful for your view on that. Secondly, you've said that after education, you're going to prioritise greater family contact. Now, obviously, a lot of people don't live in the same areas of their family, and so that will mean the lifting of travel restrictions. So I just wanted to check whether that will happen, so that quite early on, so people with family in other parts of Scotland, other parts of the UK, can enjoy that greater family contact. Thank you.
No, I can't give a guarantee about when we'll lift travel restrictions right now. I mean, I think people who've heard me will know that travel restrictions for a period may be one of the most important protections we've got to keep the virus low. And when I talk about family contact, it may not be all forms of family contact immediately. You know, care home visiting is an area that we've said we want to prioritise, perhaps outdoor over that, but we want to do as much as possible. In terms of Mark Woolhouse, I would agree generally that the data is going in the right direction, so that should give us confidence. I suppose my question would be earlier than what, because we haven't actually set dates, so there's nothing to sort of gauge that against. We will open up as quickly as we think is safe and sensible, but we will try to guard against doing it so quickly that we actually jeopardise our progress and find ourselves going backwards. You know, there will always be differences of opinion about where that balance should lie, and people like Mark are very valuable voices that we listen to and trying to come to the right judgment. Jane Bradley from the Scotsman.
Thank you, First Minister. Jason Leach indicated at the COVID-19 committee this morning that schools are likely to make a full return on a national level only, which means that children who live in an area where there's very low levels of the virus still won't have any face-to-face learning until the rest of Scotland's at a point when everyone can go back. Is this definitely going to be your strategy, or is there going to be potential for children in low-risk areas to return to school earlier?
I don't sit and watch the telly usually on a Thursday morning, so I'm always asked questions about what people have said at the COVID committee that I've not seen, and I've been busy with other things, so I don't know exactly what Jason said there. I'm not suggesting for a minute, Jane, that you're doing this, but it has been known for people to slightly misquote Jason in the past or take his comments out of context, so I'll maybe just check what he said. We have never ruled out the return to school being varied across the country depending on rates of the virus, and I'm not doing that now. I wouldn't want to be in a position of holding any children back from school if it was safe for them to be there just because it wasn't yet safe for children in another part of the country. So it's something that I can't be any more definitive than that around. It may well be that because of the pattern of the virus we see right now, we're likely to see changes, whether that's kids going back to school or other changes happening on a national basis first. It may be a little bit away before we're back into a geographic levels system, but we don't rule anything out. We want to get as many children back to school as quickly as possible, and I wouldn't want to be in a position of saying nobody can go back until everybody can go back, because I don't think that would be fair to young people. Helen McCardle from the Herald.
Hi, afternoon, First Minister. I just wanted to ask about intensive care admissions. So, as you've noted, we're seeing steady declines in cases, in deaths and overall hospital admissions, but the one outlier seems to be with intensive care admissions. So, for example, they've been falling steadily up until January the 28th, and from then on, they just have stopped declining altogether. They've actually increased a little bit, and that doesn't seem to be explained by things like people spending longer in intensive care. So I just wondered, do we know what the cause is for that, and is it anything to be concerned about?
Fiona will say a word about this. I mean, it's something we're looking at closely because we've certainly identified exactly what you just set out there. I think, say two things. Firstly, intensive care numbers never in this wave have never got to the peak that they were at in April, unlike general hospital numbers. And they are lower now than they were earlier on this year at the tail end of last year, where they kind of started to get close to that peak but didn't quite get there. So they're now today under 100. But you're right, they've been a bit more volatile and they haven't shown that sort of steady, sustained decrease that we've seen in overall hospital cases. I'm going to hand over, because I'm not sure we understand it absolutely fully, but Fiona, I think earlier on alluded to a bit of a change in the nature and the profile of people that we're seeing in intensive care, which may be part of the explanation, but I'll hand over to Fiona to say a bit more about that.
And learning, as we have done throughout this pandemic, there are a lot more treatments available which have reduced mortality and morbidity, and we're incredibly grateful to the researchers and the scientists who have have found this, and similarly with the way we give oxygen rather than needing to go into intensive care. So for many people, the treatment is better, and we have less severity and less deaths. However, our new variant, unfortunately, and as well as being more transmissible, can cause more severe illness and can cause slightly more deaths. But remember, what we're seeing here is the increased socialisation that was happening over Christmas before we put the lockdown on the 26th of December. It can take 2 weeks before you yourself become infected. So that would take you into the middle of January. And then in terms of looking at becoming unwell, needed to be admitted into hospital into February and then into intensive care unit. So there is that gradual reduction, not as fast as we would like, but the reduction there, or the stagnant numbers there, at the moment could be, and we need to keep a careful eye on this, could be that tail from the increase in Christmas, because that would be the last thing that would come down in terms of it can sometimes take 4 to 5 weeks before people go into intensive care following their infection. And that would then be that, along with the slightly more brittle approach that this virus has on people, could be giving us these figures. But it is something we're keeping a close eye on. We are incredibly grateful to all of our clinicians and the support staff who are working tirelessly in our intensive care units to give highly person-centred care in the most difficult of circumstances. But we're watching the figures, we are expecting them to come down, and it may just be following that pattern post-Christmas.
Thanks. Rachel Watson from the Daily Mail.
Thank you, First Minister. I just wanted to go back to the return of schools, or partial return of schools from next week. You've mentioned the mixing of parents in relation to transmission of the virus. I just wondered if you had any evidence for the fact that parents kind of mixing either outside schools or in relation to children going to school, if you had evidence that that was spreading the virus, and what your advice is to parents who are dropping their kids off at school next week.
This is not about evidence of particularly the virus spreading at school gates. This is evidence of when does the virus spread when people come together. So any opportunities that people might be having over the next period that we haven't been having over the past few weeks, if people aren't careful, will lead to the virus spreading again. I'm not blaming parents for that, or trying to suggest that it's school gates particularly. It's adults coming together, and what the evidence does tell us is that when we have schools back, even partially, it's not so much the transmission in schools that can lead to greater case numbers. It's often what goes around that. And again, it's understandable. If you're a parent that's had to homeschool for the last number of weeks, you'll more likely, presumably, have been working from home. If your child is suddenly back at school, you might think, well, I'll go back to the workplace. Or, you might have a coffee, or there's nowhere open to go in and have coffees right now, but you might choose to have coffee with another parent, for example, when you're dropping the kids off to school. So it's not intrinsically about the school drop-off, it's just about people coming together. So my request to parents, and I think the vast majority of parents will get this, and it's actually a request of all of us, as we start to see schools go back, let's remember for the next period, that is about getting children back to education. The rest of us shouldn't be easing up. Now, of course, parents have got to take their kids to school, but continue to work from home, even if your child is back to school. Continue to be as careful around other people outdoors. Continue to abide by them when you're outdoors. It should be no more than one person from one other household that you're interacting with. So the fact that kids are going back to school is not a sign that the rest of us can start to slip back to normal. And I know people get that and understand that, don't like it, none of us like it, and I'm hugely grateful to people for continuing to be sensible. If we, in a couple of weeks' time, if the school return has been just about getting kids back to school, I'm really confident that it will not have interrupted our progress in the virus, and we'll be able to get more kids back to school. But if it does spark greater interaction more generally, we might find that more difficult. And so it's just one of these points where it's really incumbent on me to be very clear with people. Let's make sure we are doing this cautiously and taking care not to take a quite limited change and through our behaviours make it a much bigger change that then does have an impact on the virus. Mark McLaughlin from The Times.
Good afternoon, First Minister. Aberdeen, Dundee and Glasgow dental schools will defer graduations this year because they said the students haven't gained enough experience in order to get their qualification. This may be sensible because nobody wants an unqualified dentist, but what would be your message to the dental students who are going to have to repeat a year? What's your message to the young people waiting to get into dental school who will also have to wait a year to get in because there's no room because people are repeating a year? And are we facing a shortage of dentists and longer waiting times in the years ahead because dentists will retire and we don't have a new stream coming through?
No, we need to make sure none of that is the case. This is just another really difficult thing we have to manage, and it's particularly difficult for the young people, or not necessarily all dental students are young people in that sense, but anybody who's going through dental courses and training. This was something that was announced last week. I think the British Dental Association has welcomed, or at least accepted it. They raised an issue with us about continued bursary support for some students for whom the deferral won't be a full 12 months. And that's something that we will resolve to make sure that the financial impact is dealt with. I'm really heart sorry for the impact of this pandemic on young people who've had their education disrupted in all sorts of different ways, who've had the normal experience of being young disrupted. Of all the things that make me really sad about everything we've been through, the impact on young people is right up there at the top or near the top of the list. I can't magic it away. I can't make all of these things go away. All I can do is try to help lead the effort to get us through them and encourage people to act in the way that gets this virus under control as quickly as possible so that these impacts can be as short-lived as we can possibly make them. And lastly, today, Charles Fletcher from Caledonia Media.
Thank you, First Minister. Good afternoon. The UK budget is expected in just under 2 weeks' time. I wonder what stage you're at in persuading the Chancellor to extend the furlough scheme.
Those discussions will be ongoing. The Finance Secretary will have already made representations to the Chancellor and will no doubt make more representations between now and the budget on furlough, which I think it is essential that we see the furlough scheme continue, and in a whole host of other areas, and hopefully these will be constructive discussions that lead to constructive outcomes. Thank you, Charles, and thanks to all of the journalists today. Thanks to Rachel and to Fiona for the last time. Thank you, Fiona, for all your help and advice, not just today, but throughout this pandemic. And thanks to everybody for watching. The Deputy First Minister will lead the briefing here at 12:15 tomorrow. I'll be back on Monday. In the meantime, please take heart from all of the data right now, both in terms of the virus and on vaccination. I know I do. It's all really good news right now, but it hasn't happened by accident. There's a lot of hard work by lots of people across the country getting vaccine jags into people's arms as quickly as possible. But the suppression of the virus is down to everybody watching and everybody out there making these sacrifices and sticking with it. So please keep doing it, because we're going in the right direction, but we've got to get it down further and more firmly so that we can start to then open up on that sustainable foundation that we desperately need to have. So for now, please stay at home because we know it protects the NHS, and we know, and we are thankfully seeing this in the data, we know it is saving lives. So my thanks to everybody, and I'll see you back here on Monday.